Okay, so we are recording. Could you see? So let me go back and share my screen now. Okay. So we are going to have weekly assignment clarification sessions, and these sessions are going to be tied in with the contemporary issues. So we are going to do the contemporary issues first, and then at the end, we are going to have the assignment clarification. This is where we'll talk about the assignment and you'll get an opportunity to ask some clarification questions. We are, when you write something, you think that you understood, it's understood. Dr. Lewis looked at it, it's understood. But when someone else looks at it, they may have a question. And as students, we want you to have questions. So we are going to have those weekly clarifications for you. You can stop at any time, stop me at any time to ask questions, okay? So the course itself, we talked a little bit about it, how it's an application course, but actually the focus of this course for the advanced practice nurse is the theoretical and the foundational knowledge required to provide care to persons with substance use disorder. So we are looking at at clients with substance use disorders. We are looking specifically at the LGBTQ plus population, and we are also looking at special populations. So the emphasis is on providing care to clients with substance use disorders, LGBTQ patient population, and special populations, okay? See if it's going to bring it up for me. Okay, so if you can pull up your syllabus, it's not allowing me to share it with you, so I have to look at it from another screen. So if you can pull it up for me, if you have it printed or if it's on your computer, if you can just pull it up so that we can go through it. So we talked about the course description. We talked about that. I am not going to go through the course objectives. There are 5 major course objectives. And then on the other side of the course objective talks about methods of measuring and evaluation. And what it does, it directs you directly to the modules that we will be measuring and evaluating those course objectives. The next thing is the topical outline and time frame. This talks about the weekly modules and what will be offered during those weeks. And as you see, we start talking about substance use disorders. We talk about alcohol use disorder first, then we talk about opioid use disorder, then we talk about treatment for opioid use. Then we go into talking about special populations. We talk about abuse and forensic. We talk about, again, special populations. And module 11, there's a course wrap up. The next thing is the assignment and grades. So as I mentioned, there are assignments in this course, and each module has its own assignment. For module 1, there's assignment titled Risk Contribution Factor Assignment. Module 2, Protocol and Support Meeting Assignment, and I'm going to go through those assignments with you and so forth, because I want to go through the assignments with you. We'll go back to going through the assignments. What I want you to be aware of, I'm so sorry. What I want you to be aware of is, along with the assignments, there are video lectures and quizzes. There are a total of 10 assignments and 4 video lecture and quiz. I did send you on Canvas, I put on Canvas for you, and you can pull that up also. If you'll go to module 1, it has review faculty grading assignment. If you'll pull up that document tells you about the assignment and also tells you about the faculty that's responsible for grading. It's a colorful document with greens and orange and blues. And so module 1, the first assignment, which is due January 10th, talks about risk contributing factors. And so that's the first assignment. The second module, you'll be doing a protocol and support group meeting. This is where you're going to be writing a protocol and attending a support group, and you're going to be doing an assignment as it relates to that. Module 2 has your first video and lecture quiz. So it's a quiz, it's a lecture, and immediately within the lecture, it's a quiz. So in other words, it's immediate feedback that you're getting as it relates to the knowledge that you're learning. So you listen to the lecture, you're given a question, and you answer the question, and they're very short. It's no more than, I think it's, I don't think there's 10 questions per lecture. I'll go back to the assignment, but let me just go ahead and let's talk about course information. As I mentioned, 11 weeks of coursework, 10 weeks of assignments. So there are 10 assignments and 4 video quizzes. Grading, we grade by, each assignment has its own rubric. Dr. Lewis and I worked on the rubrics, and they're very specific to the assignment. So we want you to pay attention to the rubrics as you work on your assignment. And then we want to talk a little bit about timeliness. We do have due dates for the assignment. However, we do know that you are working, someone was driving home to get to orientation. There's life in addition to school. And both Dr. Lewis and I totally believe that things happen. And so we want you to feel free. If you cannot make a deadline for the assignment, please let us know. I have to tell you that last semester, because you all know that 2020 was one of the most challenging years we would always all have to face. And so we had a lot of students that was asking for extension, and every student was granted an extension. We are not saying that we're going to do that this semester, but what we are saying is do not pressure yourself. If you do have family issues, you have work issues, crises happen, please let us know in advance. The other thing is there's about 55 of you in this course, and Dr. Lewis and I are assigned one module to grade. So that means that Dr. Lewis has 56 students to grade an assignment, and we want to be fair and we want to be just. So sometimes we may take longer than expected, and there's no expected date. There's no rule at FNU that says that we have to grade within a certain period. We try to have a quick turnaround for you so that you can get our feedback. But things happen, and if that's the case, the faculty will put out an email, an announcement saying that they're in the middle of grading. We are running out of time. Please bear with us. And so we would let you know if we're going over the time. Again, I am asking for patience because last semester I experienced that I had conflicting schedules and I run late as it relates to grading. And so I just want you to know in advance that we're not ignoring you, we're not being lazy, it's just that things happen also. Any questions so far? Someone may need to mute. We talked about the weekly, so I'm changing that from, well, I'll talk to IT because maybe it's something that I did. I will talk to IT, see if I can troubleshoot. If they're going to be triple B, we are going to have them. But nevertheless, it's going to be held every Monday at noon, and they will be recorded. Again, these are going to be contemporary issues in mental health, as well as clarification for the weekly assignments. And an opportunity to ask questions, an opportunity to bring anything to the forefront for, it will probably most likely be myself, but if there's anything that is pertaining to Dr. Lewis, we can always send her an email, schedule a time to meet with her, but this is the time that we are going to be meeting for our weekly sessions. Dr. Lewis mentioned Team STEP. Well, our course is going to be implementing Team STEP. And I'm not going to talk too much about Team STEP because I want to make sure that, and I can check right now, because I want to make sure that everyone had an opportunity to do the pre-test. And there are a few people that have not done it as yet. So I don't want to say much about Team STEP. I would say, I would talk about Team STEP next Monday because I don't want to influence the students who have not taken it as yet. But we will be integrating Team STEP in our course, and I will tell you there's nothing that you have to do extra, but in module 11 you'll be doing a reflection. If you have not done the Team STEP pre-survey, please go ahead and do that before you do anything else, because it's actually, we're looking to see if there's going to be changes as it relates to what we're going to do in Team STEP. Then in module 11, you'll be doing a Team STEP post-survey, same questions that you answered in the pre-survey. I talked a little bit about synchronous learning at the beginning. So we are going to do the weekly sessions. Then in module 9, we are going to be having mandatory Zoom classes. In module 1, you have the ability to sign up for any one of those sessions. So if you go to module 1, you can sign up says Module 9, Race and Health in America, live Zoom session, sign up. If you click there, it will take you directly to a spreadsheet where you have 6 choices to sign up for the Zoom session. They're all going to be on March 1st, the first 3 sessions, and then the last 3 sessions would be on March 3rd. So you have enough time to make time from your work schedule to attend one of these sessions. You have 6 choices.
And that time is Eastern Standard Time.
Yes, yes. Everything at Frontiers, it's Eastern Standard Time. All right, so if you haven't done that as yet, please go ahead and do that. So now I'm going to go back to the assignment to talk a little bit about the assignments. But before I do that, are there any questions? So if you pull out that colorful document, so module 1 we talked about. Module 2, you have your first video lecture quiz. Module 3 is where you'll be doing a family mapping assignment. Module 4 is the only module you don't have an assignment. Module 4, you're only going to have, you have a pre-lecture video, and then you have a video lecture quiz in module 4. Module 5, you have your second video and quiz. There's also an assignment for treatment resources. Module 6, there is an assignment. Module 7, there's an assignment. Module 8, you have your third video lecture quiz. I missed one. Module 5, I'm sorry, Module 5 is your third one, and Module 8 is your fourth one. Module 9 is the module that there's no particular assignment, but you have to attend the Zoom session, and then there are 3 questions that you're going to be answering after you attend the Zoom session. Module 10 is an assignment where you're creating a resource list for special populations. And module 11 is a reflection of your experience in the course and a reflection on you learning about Team STEP. So right now, questions.
I just wanted to say for the assignments where you will be attending a support meeting, or you're also going to be doing an interview, we know that that might be a challenge or difficult with the COVID situation. So there are a lot of virtual meetings. There's a lot of AA support meetings that they're doing virtually through Zoom. You can do the interview for the domestic violence through the phone or Zoom or some other, FaceTime, things like that. So don't feel like, you have to do it in person.
And we'll talk about that when we do the clarification. But I want to now pull up module 1. What the weekly contemporary issues and the assignment clarification will look like. But are there any questions as it relates to the course itself, orientation?
Could you go over this first paper that's due Sunday? Just give us
Yes,
a little bit more guidance, please.
yes, I will. The reason I don't have my screen on slide is I am doing 2 screens, and somehow it's not allowing me to share doing multiple screens. Technology is supposed to really help you, but I find that technology makes me more sad.
Before you go on to the assignment, there was the question about how to sign up for the mandatory Zoom class.
Yes.
Could you clarify that first?
Yes. So if you'll go to module 1, go into module 1, it says requirements. Number 4, under number 4, it says module 9, race and health in America live Zoom session, sign up. If you'll click on that, that will take you to a sign up sheet if you'll sign in right there for any of the 6 sessions.
I have a quick question. So for these Zoom sessions, we just attend. It's just like a class we attend. Is that correct? Or do we have
Yes.
to? Okay.
You'll be, yes, but you have to watch, you have to listen to a podcast before coming to class, and it's in the module.
Okay.
So this module is talking about alcohol use disorder. And so I just want to, just a brief talking about alcohol use disorder and connecting it to being a contemporary issue. And as we all know, the thing that is impacting each of us today is COVID-19 and all the consequences of COVID-19. And so alcohol use disorder is being impacted by COVID-19. And so, but what is alcohol use disorder? Well, we do have our definition by the DSM-5. I'm not going to go through the definition by the DSM-5, but the point I want to make here that according to the DSM-5, drinking in a harmful pattern that brings on distress or impair an individual constitute alcohol use disorder. And as a result of that, we have 3 categories. It could be mild, moderate, or severe. And this is how impactful it is, especially now that we are going through a pandemic. Approximately 13.9% of everyone in the United States will meet the criteria of severe alcohol use disorder in their lifetime. And so what research is saying now that this number, this percentage is expected to go up because of COVID-19, meaning that the people that you are going to be seeing in your practice will most likely have a dual diagnosis, and it could be substance use disorder. And so you have to be aware of how everything that happened in 2020 is going to impact our mental health. Deaths involving alcohol use disorder, it's approximately 88,000 every year. Again, it is saying that these numbers are going to go up, and so families are going to be impacted. Our patients' families will be impacted. And I just want to talk a little bit about the cost and how much it costs us annually as it relates to AUD. So COVID and alcohol use disorder. As I talked about earlier, stress, isolation, boredom triggers the consumption of alcohol. And what are we asking people to do, or what we are being asked to isolate, right? We are now working from home. So people now have the opportunity to drink and work because they're at home. My cabinet with alcohol is so close, so could you imagine someone that is at risk for AUD, how more at risk they become as a result of COVID? Kids at home versus not having kids at home. We are seeing in the literature is showing that parents who have kids at home, they are consuming more alcohol than before. So COVID is actually something that is triggering alcohol use consumption. And so there is this myth that's going on in the literature that says a good stiff drink can ward off the coronavirus. Well, according to research, alcohol slows down the function of the lung cells responsible for clearing out coronavirus particles. So we need to be telling our patients that, if you come across, patients that are telling you, well, I am drinking because I am told that, it can kill the coronavirus. It is not true. Science have proved that it is not true. Alcohol actually reduces the production of the immune system white blood cells. And so we ought to be educating our clients as a result of that. Then I have, which I'm going to put on the announcement for you. I have 2 articles that talks about myth versus self-medication hypothesis. So there's a self-medication hypothesis as it relates to alcohol consumptions. And this was first published in 1985. And it talks about how individuals are drawn to and become dependent. I'm not seeing my dependent on alcohol. And so, in other words, these articles talk about how there's no, that alcohol does not kill. In other words, they're saying that we ought to be able to look at evidence that shows that, number 1, alcohol consumption has gone up, and number 2, that alcohol does not kill the coronavirus. Have anyone ever heard of that myth? Because when I was doing research, I've never heard that people were saying that. Have anyone come across anyone saying that to them?
No, I've never heard of that.
Ah, Dr. Lewis, have you?
I mean, I've read some things like that people were believing that. Also drinking Clorox, which is hard to imagine that folks would think that, by doing that, they could.
It was in the news, like somewhere in Iran, people died, bunch of like 500 people died because they drank themselves to death, pretty much, when the pandemic first started. Yeah, it was in the news. Somewhere in Iran. Mm-hmm.
So there are deaths that are attributed to this whole myth. Yeah.
Yeah.
Wow. So module 1, the assignment for module 1 is that you are going to be writing a paper, and your paper is focusing on the neurobiological and social factors that are contributing risk factors to AUD. So you're going to be looking up what are some social factors and what are some neurobiological factors that contribute to AUD. And so there are definitely several biological factors. There, you know, when we're talking about the brain, because the purpose is so that you understand what are the risk factors for alcohol use disorder, and you need to discuss at least two of them. Then you're going to talk about the impact of alcohol on the brain. What are the impact of alcohol? What does it do to the brain? What are the physiological aspects of alcohol on the brain? And then you want to, the use of screening tools in the assessment of AUD. Why do we need screening tools? What is the use of screening tools? And then you're going to look at two different types of screening tools that are used. And there are several screening tools that we use both in inpatient and outpatient for alcohol use disorder. What we do not want you to do is to discuss treatment modalities. So we don't want you to talk about how to treat it. We don't want you to talk about how to treat withdrawal symptoms. We don't want you to talk about outpatient treatment. We are just looking at the biological, the neurobiological, and social risk factors. We are looking at risk factors so that you would be able to identify risk factors in your clients.
And this is the first of, is it two that are formal papers? Like the others are not as formal as?
Yeah, I think we just only have maybe two more or one more. And so we don't want you to list your answers. So we want you to write it in a narrative, because we want you to get used to writing using APA format, where you're going to use citation. I'm trying to find my APA book.
Dr. Delpech, can I ask a question, please?
Of course.
Does it have to have a running head?
You no longer need running head with the 7th edition.
Okay, that's what I thought, just making sure. Thank you.
Mm-hmm. So you're going to use APA format. You're going to have in-text citation, because you're not going to be making this up. You have to get it from somewhere. So you're going to have a cover page. And since you're going to have in-text citation, you're definitely going to have a reference page. And follow the rubric. Follow the rubric. Let me pull up the rubric for this assignment. So it clearly says risk contributing factors. Describe at least 2 or more neurobiological risk factors contributing to their impact on alcohol use disorder. Then we have APA format, screening tools. Describe at least 2 evidence-based screening tools used in the setting of alcohol use disorder. Impact of alcohol, social risk contributing factors. Impact of alcohol on the brain. So it's clearly telling you what you need to be looking for. The only thing is we don't want you to list. We want a narrative. We want you to discuss this. Any questions?
How's everyone feeling? I know that was a lot. Kind of been on for about an hour, but are y'all feeling good about it? Still nervous, stressed?
Dr. Lewis, are you able to see the chat?
Yes, I can see the chat.
If you have a question, just put it in the chat box for Dr. Lewis, and we'll go ahead and discuss it.
Nervous, stressed, overwhelmed.
And if you're nervous or stressed, let us know too.
Yeah. Yeah. Naomi, it really does. And I think that no matter what area of nursing, even if you're not going to specialize in psych mental health, I mean, you still come across patients who have addictions,
Mm-hmm.
alcoholics. And so I think it'll be very useful for everyone. So please don't stress. It's a really good course. And we're pretty easygoing, Paula and myself. And so again, just keep the lines of communication open. If you are struggling, if you are feeling stressed, just reach out to us. And that's true about the race. Yes.
Yes, Sandra, hard to focus with everything going on. Yeah, and Sandra, it is what life is, right? Life is very overwhelming, but as Dr. Lewis says, we try to keep it where this become applicable. I mean, school is school, you know, even if I told you that we would probably have 2 open book exams, which, you know, evidence have shown that open book test is much harder than, you know, regular exams. But I was just trying to say, even if we say that it's really easy, you still will be a bit overwhelmed because school is school, you know, that's the whole purpose. And so, but try not to be, Sandra. Oh, Mike, Mikel, Anastasia, I am so sorry to hear about your mom. I hope she gets over COVID.
I have a question that might be a little, I don't know, off. I'm wondering about what practitioners, if either of you have heard anything about what kind of tsunami of mental health issues we as practitioners are going to be looking at. You just mentioned like alcohol use, but I'm wondering about, you know, PTSD or, you know, certainly anxiety, depression. I don't know if this is the right place to ask that question, but I don't know if you can speak to that.
Nancy, that's a good question because both Dr. Lewis and I are in practice. And so one of the questions that we always ask our clients is, are you experiencing any stressful events, you know, recently? And prior to COVID, life is fine. Life is okay, you know. Now, I have to tell you, people are talking about being overwhelmed, increased anxiety, trauma. You know, I had a patient yesterday, I practiced on a Tuesday, that, you know, she came off her medication, she was doing well. Now she just started back school. And she said to me, Dr. Delpech, I just cannot concentrate because every day I think that I'm getting COVID-19. And so the increased anxiety, you know, GAD, you know, depression, you know, stress. I'm seeing a lot of adults with ADHD that was either diagnosed early, you know, they came off medication, but now they cannot focus, cannot concentrate. And so I'm seeing a lot of that. So there is going to be a tsunami of various things as it relates to psych mental health.
Yes, thank you. And I also, among peers, other students too, we all are kind of like, well, we never know what's coming the next day. So with politically sometimes, and so that even affects, students' ability maybe to focus as well as we should.
Yeah, and you'll find students, but then also, you mentioned peers with your as students, but peers and colleagues. I mean, the whole healthcare profession, I think, at this time is at risk for any of these, depression, anxiety, stress, suicide, burnout. We're seeing a lot of that with the COVID-19 pandemic. So just keep
Yeah.
that in mind too when you're in the
And
work.
I'm glad that you mentioned that, Dr. Lewis, because I was actually just talking to another student before we came here, and we're like, the stuff that we're dealing with, even being able to have that conversation and not have to hide it, or, if we can't do it, how could we expect our patients to?
Right. And I think it's in module 8. Maybe we should have bumped it up to the beginning, Paula, but there is a self-care assignment that you'll work on. And it really does kind of open your eyes to whether you are doing a good job of practicing self-care, or that you need to do a better job of it. And so it's in module 8, but that's definitely something that you can even share, with other students and with nurses.
And one of the
Thanks so
reasons,
much.
Mm-hmm.
and one of the reasons we decided to have these weekly sessions is exactly for that also. We want to be able to be accessible to students, to just be an air, because we do know what it is to be a student in 2021. I should take that back. We do not know what it is to be a student in 2021, because when I was a student, there was no such thing as a pandemic. And so we truly, need to be there to support you. Any other questions? Okay, well, I want to thank everyone for coming. Again, I apologize for BBB, but you're here, and it was good to see your faces, and I look forward to reading your papers, getting to know you, having discussions with you, and to have a wonderful semester.
Thanks, Paula.
Thank you. You too.
Thank you.
Thank you, everyone. Have a wonderful
Thank you.
week. And please, we are just an email away.
Okay.
Okay.
Okay?
Thank you.
All right.
Take care. Bye-bye.
Bye-bye.
Bye.